Good.
And then I need to turn on the phone.
Yeah, go ahead.
Good.
This is taken care of.
Thank you, Jared.
Yeah.
Avaya. Please enter your collaboration code followed by the pound key. The conference is now starting. You are the first person to arrive. You will now be placed into the conference.
Yeah, I'm going to. Yeah, otherwise it takes too long. Okay, so we are now coming out of executive session. It's 10:42. We had ended the executive session on time, but it took a bit to get all the electronics and everything back to scale and back online and stuff. So chair's looking for direction from the board. Mr. Kearns.
And just briefly, Commissioner French, as we come out, just to set the record, as the board knows, we've been made an offer by Mr. Dunn and the defendants in the Spokane County versus Hauglum case, and the offer is to purchase the county's parcel that is a part of that action for appraised value, which would require an MEI appraisal. So if the board wishes to either reject that, or a motion could be made to direct staff to pursue an MEI appraisal, reconsider the offer after the appraisal returns, and continue with the litigation as scheduled in the interim.
I will move to make a motion as stated by Mrs. Pilgrim.
Second that motion.
Okay, I've got a motion and a second. Any discussion? Seeing none, all in favor say aye. Aye.
Aye.
Let the record reflect the motion passed unanimously. Then that takes care of the easy business. Thank you to our guest. Instead of going into executive session for Jim Kaufman's item, because it takes so much to get in and out of it with the technology and stuff, let's touch bases on miscellaneous items. Do either one of you have a miscellaneous item that you would like to bring up at this time? And of course, if you don't have anything now, we'll also have miscellaneous this afternoon. So, but do you have anything?
Yeah, I've got something, but it'll be this afternoon after Kathleen's presentation.
Is that okay? Okay, Josh?
I don't have anything right now.
Okay, so I have on the schedule a Pioneer Human Services contract.
Brief update, Jim and I are working. The current phase 2 contract that Pioneer was on ended June 30th. And that was on a Department of Commerce grant. So just wanted you to know that Jim and I and Steve Bartell are working with Pioneer. Most likely next week, we'll bring you a draft contract extension for your consideration, which would then be the following consent agenda. So nothing more than that, Commissioner French.
Okay.
That's for the Mental Health Crisis Stabilization Center?
Correct. Thank you, Commissioner CUNY. Yes.
Okay. So, we are having our, so a couple of things to give you an update with. I had a conversation last week with Amelia Clark about coming in and updating the board on not only the status of where we're at with regard to the COVID infection rate, but also the response, and then an update on where they're at for budget allocation and stuff for the health district. And so initially we were talking about having her do that today, but then at her request, she wanted it to push it out until next Monday. So I have it teed up for next Monday morning to have that conversation. Are the two of you going to be at the 8 o'clock meeting tomorrow morning at the health district or not? I will be there, but I didn't know whether you'd be there or not too. So, and is there any specific area of focus that you would like to see that conversation go in tomorrow morning?
I was planning on Zooming in or WebEx or whatever platform it is they use. I wasn't planning on being there in person,
Okay.
but I will be on the call.
Yeah, I haven't thought about it, so I'm not sure which will be.
Okay. So,
Well, actually, as far as the budgeting go, actually, Ala, I think a legitimate question would be of the 6 million that we allocated of CARES dollars, since we're, or what are we, about 2 months ago that we made that allocation,
Yeah.
roughly? I mean,
Yeah.
it'd be interesting to know 2 months in how much of that 6 million has been allocated or spent. So
that's what she's going to give us an update on next Monday.
yeah,
And
so I would. Okay, so I mean that's really the biggest question I've got as far as the money goes. But yeah, if we're gonna get that next Monday, then yeah.
So one of the things that I wanted to raise for tomorrow morning's discussion is, where are the cases that are being identified now? And again, we had an uptick over the weekend. I was hoping we started to trend down. We had, I think it was Friday or Saturday, we were only like at 40 something or 50 cases. And then yesterday, I think we jumped to 91 or something like that. And so I was kind of a little disappointed that we had I was hoping the 50 was going to be the norm, and it turned out to be the anomaly. And we're back into the higher numbers and stuff. But are they isolated cases or community cases? And what is it that we can do what else is there that we can do to help turn this around? Because at this rate, we're never going to get to phase 3. And so I don't know whether either one of you have any thoughts about that. But I'm starting to get a little stressed at our ability to move into the next phase with the current rate of infection going on. And so just general conversation, your thoughts prior to tomorrow morning.
Yeah, when you hit on that, some of the things that I'd like to know is, and quite frankly, another reason, I mean, I get questions from the public that want more detailed information as far as, where are these coming from? What I asked a question last week at the Tuesday morning, and it looked like Bob was looking at the answer for it, but I actually never got it, was when I said, I've heard individuals reference on the news the number of the deaths and the proportion of them that came from individuals that were in long-term care facilities. And I said, is that an I said, what is that actual number? Because I haven't heard it stated by Bob Lutz or the health district. I've heard it stated by other elected officials. And so it's like, what is that number? So we have an accurate one. And I mean, if we could just get more detail on where are these outbreaks happening, what is the common connection? I know they're saying a larger number of them now are community spread, but I think it's still the majority. They have made that epidemiological connection. What are those common those common actions or common places that people are visiting that are contributing the highest? And is it something to where there's a specific industry that possibly needs to be highlighted, or some educational effort that's targeted towards a specific industry? I know we've seen some in restaurants, but is the highest amount of cases still that has an epidemic, or is the highest number of cases that are coming from an industry still healthcare? I mean, at one point, healthcare was the industry that had the highest number. I don't know if that's still true. but what are some of those measures that can be taken at an industry level to maybe help drive these numbers down? So, but I mean, essentially all we're hearing is X number of new cases, this many are in the hospital, we're not moving to phase 3. I mean, and it's like, that doesn't really give us a whole lot to go on as what can we do to help us move on. And, we've heard from the beginning, as soon as the talking points from public health officials shifted from only wear a mask if you're in healthcare to everybody should wear a mask, they had said that even the slightest increase in mask usage, you would start to see a reduction in the rate. Well, Inslee's original mask mandate that said it was punishable, by a misdemeanor or up to, some dollar amount of a fine. We should see some level of decrease, and we've yet to see that. And I don't know why that is. I mean, I know there's still a lot of people not in masks, but we've been told from the beginning that even a slight uptick in the percentage of people wearing masks, we would see some decrease in the overall spread. And so not that there would be no spread, but that there would be some impact on it. And just haven't, I don't know. I don't know. I guess these are questions that I guess Bob is most qualified to answer. And so I don't know.
Well, that's why I was frustrated over the weekend. I'll come back to you, Mary. I just want to finish up on responding to Josh. That's why I was, saw the number on Saturday, and I thought, great, we're starting to see a downward trend. And then Sunday spiked again, but it's supposed to be a 14-day incubation. So the mask requirement went in last Tuesday. So next Tuesday would have been that 14-day incubation period. So by next weekend, or clearly by the middle of next week, we should be seeing that downward trend if in fact the masking strategy is a successful strategy.
But Commissioner, remember, that's actually the second mask mandate. Remember, last Friday was 2 weeks from his original mask mandate, not the no mask, no service mandate. So,
right.
But.
No, Mary?
I agree that it takes, from the time that people start using masks and as we get more people using masks, it's like a 4 to 6 week time frame to really see the drop.
Yeah. And so the last conversation I had with the governor, he said that when we get to 25 per 100,000 per week, then he'll consider going to phase 3. At this phase, we won't hit it until next year. Then the other thing, over the weekend, a number of different labs are now projecting that they will have a vaccine approved by the FDA sometime by the 1st of December. And so if in fact that happens, and big if, then that should start freeing us up in terms of opening up the economy as well. And then the other thing is that there's now a test out on the market that can tell you within about a 5-minute window whether you've had the vaccine or whether you've had the infection and whether you have the antibodies to prevent from having it again. And so that's one of the questions I want to ask Bob tomorrow is, 1, are you familiar with that equipment? 2, if it is in fact legitimate, why do we have any of it in here in Spokane County? And if not, why not? And what would it take to get that? Because I think that's another thing that would contribute to us getting out of this thing is if we in fact have people, we're testing for people that have the infection. We're not testing for people that have the antibodies. And so that's a question. And then the other thing is hospitalization rates. Our bed capacity our bed consumption hasn't really changed that dramatically in the last several weeks and stuff. So, and according to the newspaper, about the middle of last week, they said that we don't have any more Coyote Ridge patients here in our hospital beds. So what is that true capacity for hospital beds? I don't know anymore. I thought I knew at one time, but geez, now the conversation just seems to bounce all over the place. And I don't know if the hospitals are actually now consuming that capacity so that they can recapture some of the revenue that they lost on procedures, or what is the status of that? Because deaths, we're not seeing any kind of attributable increase in deaths, and we're not seeing any kind of attributable increase in hospitals and hospital capacity. So what's going on? And I don't know.
On the hospitalizations, I think we're seeing an increase. I think we're seeing it from other counties, though, that isn't getting reported.
Yes.
And I know talking with the hospitals, because I just saw Gregory Petty here recently, and what they've done is they have capacity if they need to, not have the elective surgeries. But so many of those elective surgeries are, people in chronic pain that the longer that they were waiting, Ozzy was one of them. He couldn't have his back surgery until he got to phase 2. So it was a lot of that then was delaying people having those surgeries. So they really don't want to get back to that. And part of it, it is revenue for them as well, but it's also for the community. I mean, the longer you're you're in a chronic pain situation, the worse it is, to recover, and your joint gets worse, for the people that need hip surgeries or knee surgeries or, any of that. So they can have more capacity if they need to. But that's basically taking them back to phase 1, which, if that's what has to happen, that's what has to happen. But I don't think we're seeing, the other thing that I've heard too is that if they can get people on oxygen right away, that is helping them so they're not getting as bad, that they can recover quicker. And so, that's just kind of one of the latest things that they're seeing that they can do to help not have people in the ICUs. Because again, once they get to the ICU stage, they're in there much longer than a normal patient is. So I think that's part of what I'm hearing on the hospitalization side. But I think the other thing, I heard somebody who just recently, Max had some people, he had to have testing done over on his job site. We've heard the awful test of, you stick the swab up, to your brain, and then you're going to hold it there for a while. But I think the testing is getting better where it's not that at all. And if we can get it down to where it's not that, there was discussions with Dr. Lutz with GSI, can we do more random testings at businesses? And so they're looking into that. So, and supplies are limited. So there was talk about, do you do it's like a pool sample where everybody does a sample, but like 10 people, and then they send that in as one group, and then if that group, if there's a positive, then they know within that group somebody is or nobody. To try to look at different testing strategies. So that I would ask Bob tomorrow about different testing strategies that we can do, because the more that we can test, the more we can know where it is to then further isolate it.
So the last number I heard on hospital beds that have been consumed by the COVID is we're either at 39 or 40, but half of those, I agree with you, Mary, half of those are outside Spokane County. So Spokane County, that's only 20 that are local. And then, the death that we had yesterday, I mean, the gentleman was in his 80s and already suffering from other medical conditions and stuff, and COVID just happened to be the contributing factor. At least they identified it as a contributing factor and not the cause. But I think we are getting better at treating, and so the stay is not as long as it used to be initially. I know that in my 3 trips to the ER was not overwhelmed. In fact, there was myself and maybe on the worst condition, myself and 2 other people. And in the last trip down there, I walked right in to an exam room. There was no wait and stuff. So there's plenty of capacity in the ER. I'm assuming there's capacity in the rest of the system, but it just doesn't seem to be reflected in this community conversation about how we move forward. So I just wanted to have a general conversation in anticipation of tomorrow morning's meeting and stuff. And so maybe we can get more information out of Lutz as to, you know, where are we and how do we get better at what we're doing. So
I think part of the conversation is can we use, you know, and this is part of talking to Amelia as to what the budget is and all of that, but if, you know, can we use more CARES dollars to get more testing done? To, you know, and I know some of the testing's so backed up too. So I mean, it's just been a weird situation, but I mean, I'd rather spend money, you know, getting more tests out to the public so that people can feel, you know, get that consumer confidence back.
well, and I made the comment to Amelia, I think even when she came in, when all of us were meeting with her on the CARES allocation, was if we need to buy equipment to be able to do more testing here locally, give us a number. Tell us what we need to do. Tell us what a strategy is to improve the testing at the local level so we're not having to ship it. Now, I did see last week, Wazoo said that they'll provide some of the testing, but, you know, great.
You have a certified lab doing it.
Yeah, right. So anyway.
So one of the things about that, so at our last Tuesday morning, you know, Bob said that there were test results that were coming in. What was he saying? Like 10 days? It was taking something like 10 days to get the results. So I know of at least 3 individuals that were tested within the last like 3 or probably within the last week, and they got their test results back the same day. And they were tested on different days, you know, and, you know, they all came back negative, but they told me that they got tested and they had their results that same day. So I don't, is it just depending on where you go to get your test on how long it's going to take, or?
So the hospitals have the ability to do the testing and get the results back in a matter of a couple hours. And stuff. So I know that prior to them putting me on the operating table, they tested me and had the results before they would put me in the operating room. So they do have that capacity. They just don't have the bandwidth to do it community-wide and stuff. And that relates to, as I understand it, the kind of equipment they have access to be able to do the testing to get that quicker turnaround time. That's why I was making the comment to Amelia, whatever that equipment is, give us a price. Tell us what that is, because that quick turnaround time, I think is critical. I mean, you know, to Mary's point, I mean, they're waiting, you know, even 4 or 5 days. I mean, shoot, in that time, you could be tested, and even if you were negative when you were tested, by the time you get the results, you could have contracted it and be positive. So it's not reliable when you've got that kind of delay in the results. So I don't know.
Tested on Friday and she hasn't found out yet.
Yeah. So more conversation. But the antibody test, it's like a diabetes test. They prick your finger, get your blood, put it into the equipment. Within literally 2 or 3 minutes, they can tell you whether you have the antibodies and whether you're good to go or not. I was impressed. They actually did it on TV while I was watching and stuff. Okay. Anything else for miscellaneous? All right. So we're going to go into our next and last executive session. This is also for pending or potential litigation.
Yes.
And all present will be senior management team and all 3 commissioners. And how long do you think we're going to be?
5-10 minutes most.
So let's say 10 minutes. And when we're done with the executive session, we will then be adjourned. We will not reconvene to adjourn. We will just adjourn at the end of the executive session. So it is now, for the purposes of the record, 11:05. We'll be at executive session until 11:15.